had a really wonderful career, I think, in that I constantly seek out new knowledge and learning. I feel like as a practitioner, it's a good idea to always be passionate about your craft. If you ever kind of like lose that passion, it's hard to keep going. So I constantly look for ways to improve what I'm doing. And my goal, I guess, over the years is I've dabbled in martial arts pretty much my whole life. Most recently with Tai Chi and Qigong, doing a lot of stuff with John and Michelle over the last 2 years. And I've been studying a lot of Dr. Yang's work for many years now. I've also done several, almost, gosh, I don't even know how many fitness certifications, yoga, Pilates, CrossFit even, weightlifting, all kinds of stuff. I've done a ton of different athletic sports throughout my lifetime. And basically throughout my life, I've had a ton of injuries. My left leg is a prosthetic leg. It's titanium from the knee down. My left shoulder doesn't really attach to my body anymore because I've broken the bone so many times. I've got fractured ribs, herniated discs, and the list just goes on and on and on. And I've had an active life. What can I say? But over time, those injuries build up. You know, I'm not as young as I used to be, and I still want to be active. And sometimes those injuries can kind of prevent my ability to feel like I can be active without pain. And so over the last 5 years, what I've done is I've done a lot of research into ways that people can do self-care for their body. I was a car mechanic for 10 years before I became a chiropractor. And when I worked on cars, I kind of had this similar idea that if you have the right tool for the car, you can usually work on the problem a lot easier. And as I've been working with people in the last 11 years, I've tried to accumulate multiple different tools so that I can continue to find new ways to help people very efficiently and effectively. And so when I started this research on self-care, I was trying to figure out, okay, what tools are available? And back then, 5 years ago, it was sort of, the whole foam rolling and mobility stuff was really starting to become very popular. And there were some really good authors out, like Kelly Starrett, who wrote The Supple Leopard, and a few other people were promoting it. And I just really dived in big time to that research. And as I went through it, I learned ways to make it very appropriate for each person. And over the last 3 years, what I've done is I've been teaching a class at one of our local yoga studios here. And it's been very successful. And I've been teaching people how to do their own self-care. And so now what I do is I offer some of these online workshops. I offer telemedicine services and all kinds of different ways to teach people how to take care of their own body, whether it's just to stay active, or maybe if they want to like work on some area that's a pain area, like for me with my prosthetic leg, I've got to do certain things if I want to run or kick really high. And the great news is that I've been able to maintain pretty much all of my mobility and all of my movement patterns without any pain, just with these techniques and these tools. So today, hopefully as we go through this, you'll learn some things that are going to be useful to you. If you've got questions throughout, I'll try and periodically check my little chat box thing. I'm still getting that down. I don't see any, but I'll also stop every once in a while and check for questions as well, okay? So as we go forward here, hold on, there we go. Today is kind of an introduction. I do a deep dive on this stuff. It's about an 8-hour-long, 2-day workshop that I do. That if that's ever an interest in the future, we could somehow consider it. But this is just going to be a brief explanation of some basic theories. Some of those theories would be, we're going to start with talking about some concepts regarding pain. And then we're going to go through chi, flow, and some stagnation concepts. That's that bioelectric energy in the body. And we'll discuss those things called Ashi and trigger points. We'll talk about some acupressure techniques, different mobility tools, and then we'll go through our full body flush. I'm going to try and do for the first like 30 minutes, maybe 40, it will be more lecture stuff. Then the full body flush should be about a half an hour or so, which should leave us enough time for questions and reviewing anything else that goes with that, okay? And feel free to take breaks or grab water or do whatever you'd like throughout. All right, so I always like to ask people the question, what is pain? And a lot of people, every time I do this lecture, the number one answer is always, oh, pain is something that hurts. But the hard part about that is that it can be, that's so variable, because something that hurts you might not hurt me. And some people, you know, you can tell like they have a high pain tolerance or a low pain tolerance. So trying to define pain by just saying something that hurts doesn't quite answer the real question of what pain really is. And after lots of research and reading through lots of different material, I really like Sue Falsone's definition of pain, where she discusses pain being multivariant. It's very subjective and individual. It's cultural and situational and peripheral and central. You know, one second. The thing about it is it's always unpleasant, and with or without potential or without damage, it's actual or potential tissue damage that could be happening. And no one approach to pain management can be all-encompassing because everyone is so individual. That's why there's no one fixed cure out there for people. And so as we move through this, the most important thing for you to understand is that pain is in the brain. I'll have a little video in a minute that explains that a little bit further, but the way that you feel pain is always going to be different compared to the way that I feel pain. And a lot of that comes from the things that your brain has developed in your limbic system, in your memory system, and how it's hardwired the pain response. And so whenever you get something that hurts, your brain is always going to check in up here and say, hey, you know, have I felt this before? And if I have felt this before, how did I respond? Was it a painful thing or a non-painful thing? I really like, there's this example that another doctor gave. I really like it. He said he was walking through the woods hiking, and he was with a friend of his, and he felt something like nick the bottom of his shin on one side, and figured it was just a branch, and kept on walking. And you know, about an hour later, he started getting hot and sweaty, and come to find out, he had been bitten by a brown recluse spider and ended up in the ER, and you know, had to be on medication. It was a pretty scary situation for him. And so there was a lot of pain there, a lot of emotional fear that happened after that experience. A few years later, he was out hiking again, and he was with a friend of his, and he was walking through the woods, and he felt a very similar sensation, and immediately dropped to the ground and started screaming in pain, like it was the worst pain he had ever experienced in his life, telling his friend, oh God, you need to call the hospital. I need to go immediately. I've been bitten. I've been bitten. And come to find out, he had just had a little branch wrapped around his ankle, and it was a scratch. That's all. It wasn't anything severe. But in his brain, he had associated that past trauma as this is what it feels like when something like that touches your leg. And so sometimes our pain response, right when we feel it, is going to be reflecting whatever emotional or memories we've had in our past that we can sometimes, you know, we tie those things together inside of our brain. So there can be a rewiring process that has to happen. And we see that most often in chronic pain. People who have had chronic hip pain or chronic back pain or chronic neck pain, quite often there's some fear avoidance behavior and things that are intertwined with that have to be dealt with as well. So as we go forward talking more about this, hopefully I'll be able to help you understand that. I got to do a quick little thing here and fix my screen. There we go. So first thing I also like to do here is I'd like to break pain into two categories that helps you a little bit more. One of those categories is going to be acute pain. Acute pain is something that manifests itself pretty quickly, and it usually is a result of some identifiable injury. You know, you were walking down the stairs, you tripped, you fell, you banged your knee hurts. That's acute pain. There's usually going to have some typical responses that happen with that, both physiologically and neurologically. We'll discuss those in just a moment. When we talk about chronic pain, that's the other category. And chronic pain is something that's persistent. It's a kind of pain that will last for usually 3 months or more, and it doesn't seem to respond to traditional methods, such as rest or compression or taking pain reducers or getting care done by someone. And it can be considered a disease process rather than just tied to an injury event, meaning it can be coming more from what's going on up top. Even if the initial injury that started it was some type of an acute pain. Like a lot of people do fall down the stairs, land on their hip, have an acute pain episode. The acute pain completely heals, but they have chronic pain thereafter for a long period of time. And we find that a lot of that does come down to the fear avoidance behavior and belief system that they build in with that pain. So going forward here, we're going to just take the acute pain and discuss the two types of responses that we have with regular acute pain. So this is, you know, a traumatic injury from a sports event. You were doing martial arts, you got kicked, you know, and you've got a bruise that comes up. There's two types of responses. The first one is the physiologic response, and a physiologic response is what's going on right there locally in the tissue itself. We all know about inflammation. Inflammation is the first response. So if I cut myself, I injure myself, inflammation is going to be what happens first, where there's swelling, blood is going to flow into the area, the body's going to use a lot of the stickiness from glue to hopefully wall it off. That's why you have the swelling that happens. And then after the initial inflammation, and the body says, okay, we've been able to calm things down a little bit. Now we need to throw down some tissue so that we can stabilize this area. So what it does is it throws down this cheap scar tissue stuff. It's called fibroplasia. And this collagen that it's throwing down is not nice, you know, strong collagen like what was originally there. It's going to be cheap, haphazard, usually, you know, just really dense. And it's going to lay down not in the same pattern of what was originally there. It's just a very haphazard pattern. And that's what we really associate scar tissue with. It also has a lot more nerve innervation because the body wants to be more aware of that area. However, after time, the body you start kind of gently stressing that area, and those scar tissue fibers that are thrown down haphazardly will start to line themselves up and go through what's called scar tissue maturation. Scar tissue maturation is when it begins to basically readapt into whatever normal type of tissue was there before, whether it's muscle, ligament, tendon, cartilage, bone. Everything has this ability to go through it, and each thing has a different time associated with it. I've got a nice little slide that'll show you that in just a second. But what we see oftentimes is that people they'll go through the initial inflammation response. They'll have the swelling that happens. Everybody kind of knows, okay, I probably don't need to mess with this. You know, I tweaked my knee, I hurt my ankle. Rolling the ankle is one of the big ones we see a lot, where you roll the ankle and it swells up. And everybody kind of knows, okay, I probably shouldn't be running on that. But as soon as the swelling starts to go down, what's really going on at that point is fibroplasia. The body's throwing down cheap scar tissue. And it's doing that to try and stabilize the area. Well, that's the point at which a lot of people try to go right back to whatever activity they were at. So they're like, oh, the inflammation's better, the pain's better. Let me just run right back into running, weightlifting, kicking, whatever it was. And quite often, there's a re-injury. The swelling comes back, and the body goes back into inflammation. So then the inflammation goes down, fibroplasia starts to happen. They think they're getting better. They go back to it. They get re-injured. And then there's this vicious cycle that happens where you have chronic inflammation over and over and over again. So then the body just puts down so much of this cheap scar tissue that doesn't move, it doesn't stretch, and it has so much more nerve endings that sense pain that it becomes less functional. You have an ankle now that doesn't have the mobility it's supposed to have. It's more painful even in situations that really shouldn't have pain at all. And it's going to lead to this really slow, if even, it is possible, but a very slow scar tissue maturation if you get to that point of allowing it to happen. So I try and teach people and educate people on the fact that as you go through an injury process, it's important to recognize and honor each of these steps, and each one's going to have a different time frame. So I'm going to give you a slide that shows you the time frame so you can have an idea, but it's important to honor that, because if you allow your body to go all the way through to the scar tissue maturation, and yes, during that phase, you can load the tissue, but it's a progressive load. It's not, oh, I was here, now let me go right back to here. It's very progressive. So outside of the physiologic response, the next response is the neurologic response. And the neurologic response is called nociception. That's the pain fibers. So we have these different nerve endings in our body. Some of those nerve endings will sense movement. They're called mechanoreceptors. Some of them will sense chemical stuff. They're called chemoreceptors. And so there's several others. One of them that senses pain is called a nociceptor. And a nociceptive nerve ending is that thing that when you like hit your finger with the hammer, it's going to send a signal into the spinal cord where it's going to synapse in the spinal cord and send the message to the brain. The brain's going to go, oh, what did I just do? I just hit myself with a hammer. Oh, that hurts. Let me withdraw my hand. Let me rub it. And so it's going to give you a motor response. And that's the neurologic part. And I've got a little screen here, a little diagram that kind of shows you on the right side, you'll see there's the neurologic response. I've hit myself with a hammer. That message is going to go in. It's going to hit the spinal cord, and then it's going to synapse on a different neuron, and it's going to go to the brain, and I'm going to have that response. One thing that's super cool about this, and many times you've been walking through the living room and you've banged your knee on the coffee table, and your first response is, you're going to reach down and rub it, right? Well, that is called a pain blocking mechanism, because immediately the pain starts to feel better as soon as you rub it. Well, what happens there is when you hit the pain fiber and it sends the signal into the spinal cord, there's also an extra little neuron there that if you rub, you're going to stimulate your bigger mechanoreceptors. They're bigger than the nociceptive fibers, so they're going to quiet down those nociceptive fibers, and they're really going to dull the pain. That's why our natural tendency is to want to rub an area after we've hit it. And that's why compression and movement are very important as soon as possible after you've had an injury, such as an ankle sprain. Now, on the left side of the screen, going back to that physiologic response, those are those healing times that we talked about. And you can see there, like if you exercise really hard, you have something called delayed onset muscle soreness. That's like I did 100 squats. 2 days later, my legs, I can barely sit down on the toilet. I'm so sore. That soreness, everyone knows, usually about 0 to 3 days, depending on your level of how trained you are and how fast your body can get rid of those metabolites. You're going to go through that healing process in about 3 days. All the way through inflammation, fibroplasia, and scar tissue maturation, because there wasn't that much injury. But if you take something like a ligament or a tendon, those don't have nearly as much blood flow as a muscle. And you can see there the healing times are going to be much longer depending on the grade. So if you, like in your ankle, if you sprain the ligament in your ankle, which is very common, the anterior talofibular ligament, when you do that inversion ankle sprain, many times it's more than a grade 1. It's quite often a grade 2, and you can see there it's anywhere from 3 weeks to 6 months. It depends on the person. Everyone's a little bit different depending on their body, but that whole process all the way to 6 months is going through inflammation, the fibroplasia, and the scar tissue maturation to get the body back to normal. And so I really like that chart, because sometimes when I have to diagnose an injury for somebody and let them see, like, this is the reality of what you may be looking at, and you need to be aware of that. It doesn't mean you can't be active. It just means that there's a portion of what of activity that needs to be progressive during your scar tissue maturation phase and your fibroblastic phase. And it doesn't mean just go from I wasn't doing anything right back to your sport or activity. You do need to have that little bit of ramp up. And that's where some rehabilitation exercises, that's where these self-care things I'm going to show you can really help out. And if you use self-care and rehab, kind of some of the stuff that I'm going to talk about, you can usually bring that healing time down to those lower numbers. If you do nothing at all and you just wait around for it to do it on its own, then usually it's going to be on those higher numbers. So hopefully that makes some sense. If you have any questions about that, any questions so far from anybody? I'm just going to kind of check the chat box. I don't see any, so I'm going to keep moving on. Feel free to drop a chat in there for me if you do have any questions at all. All right, now when we talk about chronic pain, so that was acute pain. We're going to put that to rest. I have a whole talk I do, though, on how to take care of acute injuries, like sports injuries. What do you do? Like, do we still use ice? Is that a thing? In some cases, yeah, but quite often we don't use ice anymore. There's been a lot of changes. So that's a whole talk that I do for people, and we can maybe do that in the future. We're going to switch gears and talk about chronic pain. Now, chronic pain, as you probably have gathered, is a bit more complex. When it comes to chronic pain, there's a lot of different ways to try and understand it. This model that I'm going to share with you is just one model. There's a lot of them out there. I like this one because it's a little bit easier for people to understand. But chronic pain has multiple factors associated with it. And you have to consider all of them. You can have biologic reasons, sociologic reasons, and psychologic reasons that are going to affect the pain you feel. Whether it's back pain, neck pain, headaches, whatever it is, if you've had it for 3 months or more and it's become persistent, it's no longer just affecting you on a physical level. It's going to affect you on multiple different levels, and sometimes you have contributors from different places that aren't just physical. For example, I've had a lot of people that are in my office for low back pain that has been going on for 10 years or more. And the reality is, they're in a really, really bad relationship with somebody who is constantly putting them down, making them feel unworthy, telling them that they're, a bad person, just really negative. And that's going to fall in the sociologic, and you can see down there, psychological realm, where those are going to begin affecting health all the time. If you've ever seen a dog that gets whipped and hides in the corner and cowers, their body naturally goes into a state of flexion where your nervous system senses stress. It could be stress from the relationship, or stress from the job, or stress from the food you're eating, or whatever, but that stress that's coming from that sociologic or psychologic is going to affect your nervous system. And there's this nerve, it's called the vagus nerve, it's the great wonder, it's constantly aware of what's going on in the body. And it's working together with a lot of other very fancy systems, but it's going to send messages to the brain about the state of affairs. And sometimes the state of affairs is not a good state of affairs because there's this really bad relationship. I'm eating really toxic food all the time. I'm in a work environment where I'm completely stressed out. I hate my job. I don't like my boss. And then I come home and my kids are just out of this world. And we're in this constant state of stress. And the body will do this thing, it's called the GAS principle, general adaptation syndrome, where the body will generally adapt to whatever stress you put on it. And sometimes the adaptation process equals more pain because your nervous system is hyper functioning, it's hyper aware all the time. And your pain fibers are just another part of your nervous system. See that pain that's in your back that comes and goes, that sometimes just comes out of nowhere, is completely debilitating, has no trauma associated with it. You just woke up with it. It could be that, you ate pizza and drank beer all night last night, and now your gut hurts on the inside. It could be that you had a major fight with your spouse right before going to bed, and all that psychological fear and anxiety got bottled up on the inside, and it comes out as pain. And so those are places where we want to work with somebody that can help us work through those steps and identify where are the places that your chronic pain can be getting influenced by. And so that's a much bigger talk, as you can expect. But I do want to share with you a quick little video that hopefully helps. Hold on, I think I had one question. Yeah, let's take a couple of questions real quick before I show the video. If you guys want to, I don't know how you want to do that. Do y'all want to unmute yourselves, or?
I can ask for them. We had three, or I guess 2 questions. 2 of them were similar.
Okay.
One of them was, what about if nerve damage is involved? What about like the recovery time for that as well?
So there's a lot of different kinds of nerve damage, but usually it's either peripheral or central. But if we go back to that slide on healing times, let's see if it'll, whoops, hold on. We don't want to do that yet. That's the video. Where's my keynote? So when we come down here to healing times, oh, I did not include nerve in there. I apologize for that. Nerve healing, for example, like a disc herniation. Most disc herniations that do protrude and put pressure on a nerve, if you go through a rehab process, it's going to be 8 to 18 months is usually the healing time associated, especially with a herniated low back disc herniation. It does, when it comes to nerve injury, you have to identify the type of nerve injury. So if it's compression based, somewhere in the peripheral, meaning like you have a muscle that's strained, or fascia or something that is compressing a nerve bundle, if you don't remove the compression, then you don't remove the injury and the nerve doesn't heal. But if you remove the compression, then the nerves, they have the ability to heal for sure. As long as it hasn't been completely severed or something, it has the ability to heal. And it usually does take anywhere from like 8 to 18 months for many of them, whether it's central or peripheral. And I hope that answers the question. There's other types of nerve damage, like diabetic nerve damage, where you've like just your diabetes has gotten completely out of control. That's way harder to answer because it's going to be very individual. I hope that answers the question. What was the second one?
Another one was, can you explain why the bone heals faster than ligaments?
Why the bone heals faster than what was that?
Than ligaments.
Oh, well, bone itself, it does depend on the type of injury. Hold on, my screen is blocked from the chat. I got to move it over. There we go. So you see down there, it'll say 5 weeks to 3 months, and then ligament, it'll say like a grade 3 is 5 weeks to 1 year. Let's take each one of those. A grade 3 ligament means it's usually been torn completely. And so the length of time of healing is so variable because it depends on whether or not you actually get those ends reapproximated and if you're able to keep the joint from moving. A bone, if you break your bone, if you break your femur or break your humerus, we're not moving it. It hurts too much. It's going to definitely stay still. As long as it stays still, the bone's going to heal usually in about 12 weeks is for most people. We usually say 10 to 12 weeks. It's not moving. It's right together, and the body's going to heal it very fast. And the cool thing about bone is that's where we get our red blood cells from, and there's tons of blood flow. So the blood flow is really heavy inside the bone, and it's going to heal itself very quickly. A tendon or a ligament doesn't have as much vascular blood supply. It doesn't have its own red blood cell supply on the inside. So when it's torn like that, the other thing is it's usually next to an ankle bone or something that moves. And it's really hard to get patients not to move their ankle or their knee or their hip for the time period that they need to in order for it to reapproximate, especially if it's a grade 2 or 3. So hopefully that answers that question. And was there any more, John, before moving on?
Yeah, we had one more. Would you consider nausea a form of pain?
Nausea can definitely, I guess, no, it's not classified as pain, number one. But it's a symptom, and it can be a symptom that is created from pain, especially if, the pain is so high. It's like, oh my God, this pain is so high that then you feel nauseous. That can definitely happen. But I don't believe that nausea is a pain. They're not the same. Okay, so I'm going to kind of move on past the biopsychosocial model of pain. So we've discussed acute and chronic pain and a little bit of some pain science. And I want to sort of move into a little bit of a different way of thinking for a moment. And I want to talk about maybe a system that many of you are familiar with. It's our bioelectric energetic system that's on the inside of the body. We call it chi energy. In the West, we tend to break people into different parts of their body and different systems, right? We've got the digestive system, the cardiovascular system, the nervous system, the muscle system, the skeletal system. And for some reason, we've left out the meridian system. I don't know why, but in the Eastern medicine, it's 100% there, and it's 100% important to know about because this is what basically powers everything. I like to think of it very similar to our fascial network. Our fascial network is in and out of everything, providing a lot of the support and framework for movement. And this is the power. This is the energy that's going to supply all of that stuff. And what it does is it flows through the body in all of these different patterns. You've probably heard of some of them, like the gallbladder meridian or the conception vessel, or different ways that they flow through the body in different patterns. And over the last several thousand years, people way smarter than me have been able to figure out a lot of those patterns of how the flow is. And what's super cool is sometimes you can actually see some of those patterns of flow match some of the patterns of fascial flow too. So there's a lot of like meridian fascial integration work that's happening these days. And some of the stuff that I'm teaching you is along those lines. But as it flows, just like a river or a creek, a rock falls into the creek, and suddenly as the water's flowing, it hits the rock, and now it's got an obstacle there. That obstacle can be an obstacle that it can easily sort of go around, but if too many things fall in, now we've got sort of like a damming up process that happens, and when the water gets dammed up, we have stagnation. Stagnation is when it just slows down, the energy pools in an area. And just like the stagnation in a river or a creek, you're going to see, a change in the ecosystem there. The same thing happens in your body. If you've got a stagnation build up in one of your chi meridians or the 8 vessels of the body, then that stagnation can build up, and sometimes it's going to create dysfunction that can be on the inside of the body or the outside of the body, and a lot of times you'll feel pain. And in the Eastern medicine concepts, a lot of the pain we feel, especially like muscular pain, trigger points, they're going to call that chi stagnation in different parts of the body. And so when I'm working with you, teaching the class here, we're going to use that concept of chi stagnation and flow to link it with trigger points. In the West, we call these things trigger points, those hyper-reactive, tender little spots that are usually in muscles and fascia throughout the body. In the East, they call them Ashi points, because as a practitioner is palpating, quite often the person would say, Ashi, 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 meaning it hurts, right? When we talk about them, there's basically 2 kinds that we talk about with trigger points or Ashi points. They're active trigger points or latent trigger points. What that means is, let's say I'm rubbing here on top of my shoulder, I'm in the upper trapezius, I press down, usually gallbladder 21 is the point, but there's other ones around there. You press down and suddenly, oh, that's sore, that's tender. If it's only sore right there and it doesn't hurt anywhere else, it's not referring pain anywhere else, we call it a latent trigger point, meaning it has the potential to cause dysfunction, it may or may not be, and it's just a hyperactive tender area. However, if I press down on that area, but I then get a sensation that travels up into my head or my neck or goes down my arm, creating a referral pain pattern, that is an active trigger point, and it's definitely causing some type of dysfunction. Usually it's going to change the movement system. You might not be able to rotate your neck as well. You might not be able to lift your arm and move it as well. But that stagnation, where there's not as much flow, being blocked by that tension that's built up in the muscle belly, is definitely causing dysfunction. And so as we go through the class we're about to do, we're going to be searching, and that's the first thing we do with our mobility tools, is we search for areas of dysfunction, and when we feel them, either A, it's tender right where we feel it, or B, it's tender there and it sends pain somewhere else. Usually the ones that send pain somewhere else are the ones we want to sedate or bring down. We want to try and treat those areas. If it's something that just feels pain in that one area, we just disperse it. We don't spend a lot of time on it. We're just going to try and disperse it. Okay? I know these points we could go a lot deeper into, but it's just sort of a general understanding. And then kind of the last part we're going to talk about before we get into the tools is some acupressure techniques. And I've just touched base on some of them. You may have had acupuncture done, but acupressure is very similar. You're just not using needles. The goal is quite often the same, though. There's 3 main techniques that we're going to talk about. There's other techniques out there, but there's only 3 that we're going to talk about. Those 3 are going to be dispersion, tonification, and sedation. The first one, dispersion, we just talked about. And the goal there is to disperse stuck chi. That's an area where there's tissue tension. I feel really tight in this area. It's tender. It's not really referring pain. That's an area where we're going to use dispersion. And usually with dispersion, it's like somewhere in the middle of tonification and sedation. And I'll talk about those in a minute to give you an idea. Tonification and sedation, think about them on two opposite extremes. Tonify is to bring the level up, to invigorate. Sedate is to bring the level down or inhibit. So we've got facilitation or tonification, and over here we've got sedation and inhibition. Let's just say, for example, you were going to do your Tai Chi or martial arts practice. Well, right before you practice, the last thing you want to do is inhibit the function of your body. So we're probably not going to do sedation techniques. We don't want to turn our muscles off. We want to invigorate. We want to facilitate, get our body ready to go, like a warm-up. So we want to more or less do more tonification work. But at the end of the day, you've been working all day long, your body feels wrecked, you're tight. I was out in the yard all day doing yard work, and I'm just wrecked after that. I've got pain in my upper trapezius. We want to do more sedation. We're looking to bring the level down, inhibit, create relaxation. They're totally different on two different ends. When we're using our mobility tools, if you are doing tonification or invigoration, what we're going to do is we're going to spend less time, we're going to move faster, and we're not going to go as deep or cause as much pain. So it's more superficial. On the other end of the spectrum, when you're trying to sedate or bring the level down, we're going to spend more time. We're going to go deeper. It's probably going to be a little more tender as you do it, and we're going to move slower in the area. So those are complete, like yin and yang, right? One is more yang, one is more yin. When we're yin, we're moving slower, going deeper. The pain is going to be a little more. Yang, we're going to go faster. We're going to be way more superficial. We're not going to spend nearly as much time. So hopefully that helps you very quickly and easy understand those concepts. They're the same concepts when I treat a patient in the clinic. Exact same. I don't do anything different. So we're going to move forward now. We're going to talk about different tools. This is a great spot to ask if there's any questions so far about what I've just talked about before we move into now the class format. Anybody got anything for me, John, or is this a good, can we go forward?
So far nothing, but I think maybe we'll give 30 seconds or so for people just in case they need to type.
So right now is a good time. If you don't already have one ready next to you, grab a foam roller, a little space on the mat. We're going to start here in just a second. We're going to move into the mobility tools, and we call them mobility tools. I call them acupressure tools, or you can call them whatever you want. I was a car mechanic for 10 years. I had a toolbox. Inside my toolbox was a ton of different tools, screwdrivers, ratchets, hammers. That's what all this stuff is. And in order for you to know which one to use, a good mechanic knows what he's going to be doing on the car because he's assessed the car first. He's looked at the car to see what it needs. If you want to use the right tool, you need to assess yourself and ask yourself, what do I need right now? Do I need to be invigorated? And do I need to tonify? Am I about to do a workout and I need to turn my body on? Or am I in pain? Is it the end of the day? Do I need to relax my body? Those two concepts alone will help you pick the right tools and help you decide how to use them the right way. The only other confusing part is, do you use something that's high-tech or low-tech? In today's society, there's so many different ones. I'm going to show you a couple of quick examples. But like our low-tech options for most people are going to be something like a simple foam roller and a lacrosse ball. These two things are the main two things I make sure I have. I love these more than anything else. But these two things will get you going pretty much any time. Now, there's a million different foam rollers, right, on the market. Some of them are hard plastic. Some of them have knobs on them. Just think in your mind, is this tool going to go deeper, harder, making more pain happen? Or is it going to be more superficial? Is it going to not go as deep and not hurt as much? So like this foam roller is what I would call a more superficial foam roller because it doesn't have little nubbies sticking off of it. It's a medium firmness. This is my go-to foam roller. It's made of foam. But then you have the really soft ones that are super squishy. There's no way those are going deep. Those are going to be super superficial. And then the ones with the knobs on them that are hard, or a PVC pipe, well, gosh, that's hard. It's going to go deeper. The difference between this and this is going to be the surface area. This has a large surface area, meaning it cannot penetrate the tissue as much as this. This is smaller. Just like my fingers, if I'm working on a patient and I do a fist, and I'm working on them, and then I use my finger, the finger is going to be able to go in deeper and penetrate deeper into the tissue. That's what this will do. So guess which one is going to be more for tonification and one's more for sedation? Tonify, sedate. Simple, right? You want to go deeper? Use this. The only other place that this matters is going to be where you're working. So like if I'm working on the bottom of my foot, I'm not going to use the foam roller. I'm going to roll the bottom of my foot on a lacrosse ball, no matter if I'm doing tonification or sedation. It's just how hard I push and how long I spent, right? Now, if we put those down, we've got other fancy tools, and these things just cost a lot of money, and the main difference is they're more efficient. So like this guy is a percussor. It's going to move like this, percussion, and it also has variable speed. Guess what? If you go faster, it's going to be more invigorating. If you go slower, so there's that slow setting versus a faster setting, guess which one is more superficial? Guess which one is deeper? The slower one is going to go deeper. The faster one's going to be more superficial. So it depends on how you're using it. Same thing. Now this one is vibration technology. Percussion means it's going like this, hitting the tissue. Vibration means it's going to hit the tissue and vibrate and shake. This one is usually a little more superficial depending on how hard you're hitting. It does not change fascia as fast as percussion. And they just have different ways that they work, but the same as far as does it inhibit, does it sedate, does it invigorate, and how hard you push, how long you use it, are all you really need to consider when you're using them. If you want to talk more about those things, we can do that in the future. I always tell people, if you're a newbie, start with a foam roller and a lacrosse ball. You cannot go wrong with those. They're super affordable. This thing is like, I sell this for 15 bucks in my office. This is $2 in my office, and you can get them almost anywhere. So those are the tools. Now what we're going to do is we're going to switch gears, and we are going to go into a nice full body flush that we're going to work through. So I'm going to, John, if you want to just keep it on this screen, I don't need to share my other screen. I'm going to get myself set up. We're going to go through a nice little full body flush, okay? Any questions before we do that? I see there's something in the chat box there.
No, that was me. We didn't have any questions, but we did have a comment of someone saying it's all good stuff so far. So thank you.
Thanks. All right. So I'm going to just kind of set this up so you can see, hopefully, my mat. I'm hiding out in my little garage. I have 3 children that are outside running around like crazy in case you hear something.
Maybe while you're setting up, we did just get a question now.
Okay.
What do you mean by a full body flush?
So a full body flush is, and I'm going to talk about that as we go through, but a full body flush is what I do at least once or twice a week, that I go through and I systematically search through the tissue, looking for those latent and active trigger point areas of the body. And I use some dispersion or tonification techniques or sedation techniques as I go through, and I do the whole body. There's other times when I'll do like specific areas, like regional areas, or more local, like right at the knee. Let's say I've got some basic patellar pain that I've got that day from walking. I might do just my calf and just my quad. But at least once a week, I like to go through a nice full body flush. So what you're going to get right now is the self-care that I use pretty much every week for my full body flush. And that's what we're going to do. All right, let me just back this up a little. I think you guys should be able to see me okay out here. All right. Everybody can see me okay, right, John? Can you see me okay?
Yep.
I'm just going to center that a little more. So I am going to use a foam roller for this. I will show you there's 2 different kinds. There's a short 18-inch, and then there's a 36-inch. Really is no difference when you're using it, except for I like this one because I don't feel like I'm going to fall off sometimes as I'm moving around. But this one is handy for just storage, travel, and all of that. So I'm going to use the longer one today, But it makes no difference if you're using a short one or long one for yourself, okay? When it comes to the lacrosse ball, like I said, I use that on the bottom of the foot. If you don't have a lacrosse ball with you right now and all you have is a foam roller, that's fine. But if you want to start on your foot for a moment, you can. You can throw a lacrosse ball down and roll it. And I'm just going to show you this quickly because I don't think everybody has a lacrosse ball. But hey, John, how is this? Is it blurry or is my screen okay?
It's a little bit blurry, but we can see the motions that you have.
I can change my focus on the camera real quick here. Hang on. I want them to be able to see so they can. Settings. Well, I think that's the best it's going to give me on Zoom right now. Sorry guys, that's the best my camera is going to give me. Hopefully you can see okay though.
Yeah, I think we can tell what you're.
Should be able to tell what I'm doing, and we're going to be sending out a nice high definition version of this as well at the end. So when I roll the bottom of the foot, I basically roll from the base of the heel towards the ball of the foot. I roll front to back, side to side, and do circles, and then I'll hold down in different areas that feel like there's tenderness. Like I said, I'm not going to do all of that today because I don't think everybody has a lacrosse ball, but I do include that in my full body flush when I'm working with myself. All right, so we're going to start with the foam roller. You're going to put it down on the ground, and you're just going to put your legs on top of it. The back of the legs is the calf area, and all I want you to do is I just want you to roll the roller in and out, just like this, like I'm doing, okay? What you'll notice is, first of all, the roller does kind of migrate up behind your knees, so you might have to push it away for a little bit. As you're doing this, the first thing we want to do is we want to talk about searching through the tissue. So you'll notice I'm not lifting up my body and pushing as hard as I can because I don't even know what's going on. All I want to do first is I want to ask myself, what do I feel? What does it feel like? Do I feel lumpy, bumpy areas, or does it feel smooth? Because that's one thing to pay attention to. If you feel all of these lumpy, bumpy things, then that's usually areas of what we call densification, meaning the fascia or the muscle is densifying. And a lot of times those will have tenderness. Now, you also want to, with your feet, point them straight up in the air to get a sense of what the middle of the calf feels like, but also point your feet one direction. So now you get the inside of one calf and the outside of the other, and then turn them the other way, and you can get the same sensation there. One calf probably hurts more than the other. One of them probably has a little bit more lumpy bumpiness. So what I want you to do is I want you to put your other leg on top of the one that has that, and I want you to search for one of those little lumpy bumpy spots, and I want you to pause and hold over this. So there's three main techniques we're going to talk about: compression, cross friction, and pin and stretch. Each one of those can have its own type of dispersion, stagnation, tonification or sedation. Compression is usually more sedating, meaning we're just hanging out over an area, we're adding pressure to the area, which cuts blood flow off. So if I'm on this trigger point, it's active, maybe it's sending some tension up my leg or into my foot, and this is an area where I might sedate. Now I'm going to kind of keep going. I'm going to find another spot in that same leg, and on this spot, what I'm going to do is I'm going to hang out over it with just a little bit of compression, but I'm going to move my legs sideways, side to side. As you wave your legs side to side, you'll feel like you're going over the bump, ba-boom, 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 and that's cross friction. We're creating, like the muscle goes this way, we're going perpendicular to that, creating a friction area. Now that cross friction, depending on how deep you go, is usually a little more invigorating to the area. So that's a little bit more of a tonification technique. And then the last one, let's find one more spot in that calf, pause over it. The last one is to add your compression and then to point and flex your ankle. As you point and flex your ankle, you've got the tissue pinned down, and now you are stretching it by moving the ankle, so we call that pin and stretch. These are very basic massage and acupressure techniques. So let's go to the other calf now, and let's see if we can find some of those points. For the duration of this class, you do not necessarily have to move on as quickly as I move on, because you are in your own body right now, and you need to listen to your own body and see what it feels like. Some of you don't have any tender spots in your calf at all. Some of you are runners, and you're like, oh my gosh, this is terrible. When it comes to pain level, no matter what you're doing, whether it's tonification or sedation, on a scale of 1 to 10, we don't really want to shoot it over like an 8 at the most. Usually it's a 7 or below. Areas like the IT band and quads are going to definitely creep up to an 8. And if you think about it, if you're doing more inhibition, then the pain level is a little higher, then you are going to be in that 7 or 8 range. But if you're just invigorating it and tonifying it, then we're going to keep the pain level down, and we're going to move a little faster. All right, so I'm going to give you about another 30 seconds to finish up your calf, and we're going to move on. So feel free to find another spot, pause over it, try one of those techniques, pinning and stretching and moving the ankle front and back. Sometimes I'll do all 3 techniques in the same area. Now, the last thing we didn't touch base on specifically yet was time. When it comes to how long you should spend in one specific area, it depends on if you're tonifying or sedating. Number one, we're never going to spend more than 60 seconds. Too much is too much. You can't cut the blood flow off that long. You're going to cause bruising. I can't tell you how many times people come in and say, Doc, my leg hurts. I foam rolled for an hour last night. I was like, oh, that's a little bit long. You definitely want to spend less than 60 seconds no matter what. But if you are going to tonify, you're going to invigorate, we want to spend less time, then it's going to be 10 to 15 seconds. That's it. If you're trying to sedate and inhibit, then we're going to spend about 30 to 40 seconds in each area. For the full body flush, we're going to do a little bit somewhere in between. Sometimes 10, 15 seconds, sometimes 20 seconds. Especially in areas where I know that people generally have chi stagnation, which is going to be the calves, the quads, the outside of the legs, a little bit in the glutes, and a little bit in the back. Those are areas where we'll definitely spend a little more time, okay? Now what I want you to do is we're going to bring that foam roller up to right behind the knees. Just let the legs rest over the top, lean back, and wave your feet in and out. Right behind the knees is something it's a pretty cool acupuncture point called bladder 54. It's the master point for all low back pain. I think that's so powerful and cool because it really does work, number one. But number two, there's a muscle called the popliteus muscle that goes at an angle behind the back of the knee. And that's what you're basically massaging right now. There are some large blood vessels. So this is not an area where you want to spend a lot of time. You don't want to really go hard here. And as we discuss that, keep waving. And this is the kind of the main no-no when it comes to self-care and mobility. When you're rolling, the main thing you want to avoid is the bump, bump, tingle, tingle. So right now is a spot where if you push too hard, you might actually feel a bump, bump, bump. That's called a blood vessel. And we just want to move off of that. So we don't really want to spend time on top of large blood vessels. Also, if you feel it radiating like a tingle down your leg, then that's usually a nerve bundle. Nerve bundles are also places we don't want to spend a lot of time. And I'll tell you where they're at as we go, but the back of the knee, the front of the shoulder, front of the hip, those are the main places that you're going to have those problems, and we don't really spend much time there as well. Let's go ahead and bend the knees, roll the roller in as close as you can towards your butt, and then what you're going to do is you're going to straighten your legs out, and we're going to hinge our body weight forward, and we're going to pop up onto the roller. So now we're rolling the back of the legs. And depending on how long your arms are and your torso, you might have your hands back a little bit, but I don't want your hands so far back that you feel like you're stressing your shoulders too much. You want them a little closer to your body. Then we're going to roll in and out. And just like we did our calf, we want to first start with our feet pointing straight up towards the ceiling, rolling the middle belly. And then we want to point our both legs over to one side, rolling the inside of one leg and the outside of the other. And then we're going to turn our legs facing the other way, rolling the inside and outside. Now, one of those you're going to notice was more tender, whether it was the left or the right. And just like we did with the calf, you can take a break and you can stack one leg on top of the other. This causes more pressure. Now, for you, you were already at a 7 or 8 or 5 or 6. don't stack your legs. Just keep with 2 legs. There's no reason to add more. But if you want to add more, then that's how you do it. You stack the leg and put a little more body pressure on. And here, it's hard to do pin and stretch because we can't move our knee that well, but we can do cross friction. So we can pin down an area and go side to side. And if you want to focus a little more on the inside hamstring, sometimes I'll bring my hands over and turn my body towards that side. You can also go down to the elbow if that's permissible to you. When it comes to rolling and body mechanics, it's 100% up to you. You just want to be comfortable. Your neck and shoulders shouldn't hurt while you're doing this. You do a little on the outside. You can do the same thing there. We can pause, go side to side for cross friction, or adding just compression is a good one. Now, I don't find the hamstrings actually are one of the worst areas of chi stagnation, so I don't spend a huge amount of time. But for people who do have hamstrings as a major area, there's another technique I use. It's usually sitting in a chair with a 5-inch ball and sitting on it, and that's the best for inhibition. So if you've done one leg, go ahead and switch and do the other for me. I always start with the leg that feels like it needs love the most first. That's the dispersion. That's what you're doing. You're getting a sense of which one feels like energy is stuck more there, and you're trying to disperse that. It helps to create balance in the length-tension relationship of your soft tissue with your joint structure. So each one of these muscle bellies and fascial areas that we're rolling has a length-tension relationship that's the best for it, meaning how tight or how loose it is when you're in standing posture and movement patterns. And if it's too tight or not tight enough, then it will change your movement pattern or your posture. And if you find a spot on the other leg you want to focus on, like I got a good one here, I'm just going to go side to side, just like that. Good. Now what we're going to do next is we're going to sit on top of the roller. So you're going to bring it towards you. You're going to sit on top of the roller. Now, you should be able to sit on it and balance pretty well on top of it, sitting on your sit bones. The only other thing about the rolling that we really don't usually do is we don't roll on bones, like on your kneecap or on your elbow or on your sit bone. We're trying to address the tissue on either side of it. So what I'm going to do here is I'm going to tuck my butt under, and that's going to get me access to my glutes in the back. I'm going to put my hands here, and I'm going to roll right in the middle section. That's where your sacrum or your tailbone is. Most people don't find this to be a very terrible area. It's usually a place that doesn't function as well, actually. It usually doesn't. Our hip extension pattern is quite often one of the patterns in our body that doesn't work as well. And so I usually don't spend a long time here because I want to invigorate this area and turn it on. So I stick to a superficial, and I usually move a little quicker, and I stay there for less time. But just to the side, so bring your feet together, drop your knees over to one side. You can bring your hand over on your knees, or you can keep it here, wherever's comfortable. What that does is you basically lean over, and if you had a back pocket, you're kind of rolling where your back pocket is. Now that spot is an area where we get major chi congestion, chi stagnation. In fact, it's another master point when it comes to treating back pain called gallbladder 30. Here what we're going to do is we're going to use several different techniques. So number one, just rolling and getting a sense of how this feels. Now switch over to the other side and let's see how that one feels. And like I said, I like to check both sides first and go with the one that seems the worst. Now, whichever one is the worst, like you feel the lumpiness or bumpiness or tenderness, that's the one you want to stick on. I'm going to go, my left side was a little more. That's also, by the way, the side that's going to be your outside IT band and quad that's usually worse as well. So we're going to go up and down this side. Now I'm going to pause over it if I feel the lumpy, bumpy area, and I can just swing my legs side to side, and that's my cross friction. Or I can pick up my leg and I can lengthen it and straighten it and bring it back in. And that's going to be my pin and stretch. And then another really cool technique is you can back off a little bit and you can figure forward that leg. So the same hip I was on, I'm just going to cross the foot over, drop the knee away. And then as I go back onto that, what I've done is I've tightened up my glutes and exposed my deeper rotators. This is like the piriformis and some of those obturators and superior and inferior gemelli, some of the muscles that function like the rotator cuff muscles of our shoulder. They're the rotator cuff muscles of our hip. So this is usually where you get into some juicy stuff here. I usually have to kind of pause for a moment, find a good one. Compression works really well, going side to side. You can also play with bringing your body down to the elbow. And you can see there's a little bit of a different orientation of how you affect those fibers. And you can swing the hips a little easier sometimes on the elbow. Good. All right, so what we're going to do now is we're just going to come up and we're going to switch sides. And again, you can go at your own pace. If you need to spend a little more time in that area, cool. If you're ready to move on, then just join me. We're going to go over. You can see now this glute's totally jealous. It didn't get nearly as much love, so it's hunger for it. We're going to move up and down, get a sense of anything that's tender that you want to work on. Again, you can swing your leg side to side. You can also pause over it and lengthen in the leg in and out. Here in the glutes, I do tend to use a combination of all of the techniques because there's just so much glute, right? Glute max, glute medius, glute minimus, that's 3 levels, and all the rotators underneath. And then I like that figure 4 shape, tightening up the glute, exposing those deeper rotators. It's important to try and still smile in case you're grimacing. I can't see you, but I know you might be. And remember, keep your pain level below a 7 or 8, okay? This is an area that sometimes the sciatic nerve is here, and if you feel something that gives you a tingle down the leg, then you move like half an inch and you're off of it, and you're on something else. But you're not gonna hurt the sciatic nerve. It's so big, it's one of the largest nerves in our whole body, and quite often it's entrapped within the piriformis muscle or under it, and doing this work is gonna help a lot, especially if you have piriformis syndrome. Good, now you can also come down to the elbow if you liked doing that. Good. And next what we're gonna do, let's come up. We're gonna go back to that leg that we started on, that first hip. We're gonna work down the outside part of the leg. Now this is usually one of the #1 most tender spots in all of the body for everyone. There's 2 things to avoid: the outside of the hip bone. So if you rub the outside of a hip, you'll be able to find your hip bone, and the outside of the knee bone. We're just going to be right in the middle, rolling from here to here. And I find the easiest way to get there is to just put your body weight over, straighten out the leg, and roll the roller down until it's about middle of the thigh. And I come down onto my elbow, and I'm going to step my top leg over. And then we roll up and down the outside of the leg. Now, I know I can't even see you, but I know you're grimacing. Try and smile. This area is an area that you want to first search thoroughly. It doesn't take much time to find where is the worst part. Is it a little higher up or a little lower down? When you find it, pause and bend your knee a couple of times. That's your pin and stretch. Usually that's the one I use the most. I do a little cross friction, meaning I can sway my body side to side. But there's one more technique that I really, really like in the IT band and in the quads. It's called the fluid wave. What you do is you can start like down by the knee, and you start creeping your way up towards the hip. And you'll notice you come into contact with the edge of a really tender, lumpy, bumpy spot. And you pause there for a second. And imagine you're trying to slide a marble under a bed sheet. So you're going to push on that marble and try and slide it under the bed sheet. So that's what you're doing here. You're just going to gently push on it and slowly imagine pushing that little trigger point, that lumpy, bumpy spot, up towards the hip. And as you push and push, you feel the tension build up and build up and build up. And then, boom, boom, you go over the marble or over the spot. And that's one way to kind of break it down a little bit more. Good. Go up and down a couple more times. Feel free to pause, bend the knee a few times, and go side to side. Good. And then what we're going to do is we're just going to flip. So what I do is I just go over onto the quads for a brief second. We're going to come back to those. And then I flip over, and now I'm on the other side. I'm going to move my microphone so I don't hit it. All right. So we're going up and down the outside. And you may notice, like, wow, there's a big difference from side to side. One of the things that we are doing with this full body flush is we're paying attention to areas of asymmetry. That means, how's my left side feel compared to my right side? And like I said before, our goal is to balance the length-tension relationship throughout the whole body and to disperse all that chi stagnation. Well, if there's a big imbalance, meaning your left side is super tender, but your right side doesn't hurt at all, then you have a lot of chi stagnation on one side. And that's going to affect your movement patterns, your posture. It's going to affect everything. So pay attention to your asymmetries, especially if they show up all the time the same way. That means you probably have a movement pattern you're doing that's bringing them back. All right, so any of those techniques are game here. You can bend the knee. You can go side to side, or try that fluid wave where you go up nice and slow, finding a spot, anchoring onto it, and then pressing a little more as you go up.
Hey, Lance, someone's asking if there's a way to do this without putting so much strain on the shoulder.
Absolutely. So what we do, I do have modifications. It's really difficult to teach that in a group setting like I'm doing right now, but the modification is to do it standing up against the wall with a 5-inch ball. I don't have my regular 5-inch ball, but I usually use a 5-inch ball, and I'll put myself up against a wall, and I'll be able to do that same IT band area with a 5-inch ball. If all you have is a roller, sometimes you can do the same thing with your roller. You can put your body weight up against the wall and you can roll, especially in the legs and the hip area. So that's typically what I'll do if you want to reduce the strain on the shoulders the most. Hopefully that helps. And then at the end, if there's any more questions, I can go over those as well. All right, so we were just on the IT band. We're finishing up one side. Now what you're going to do is you're going to roll over face down, and we're going to the quads. Now the quads, the front of the leg, is going to be everything from the kneecap to the groin. And guess what? We don't roll the kneecap, and we don't roll the groin. We're going to roll everything in between. This is a pretty tender spot. So as you go, be mindful of your pain level. You're just going to roll the roller up and down. And just like we had to do with our hamstrings and our calves, we want our feet to face straight down towards the floor. And then we want to turn our feet one direction. So now we get the inside of one quad and the outside of the other one. Try not to scream. And then we're going to turn them the other way. And we're going to get a sense of which one hurts the most. Now, I'd say 90% of people always feel it worse on the inside or outside of one quad. And most people don't need to stack their legs and put more pressure. So I usually just stick with both legs on the roller at the same time and pick which one was the worst. And we're just going to go up and down that side. As you're doing it, the same thing we did with our IT band, where you find a little spot, you can bend your knees. That works really, really well. Also, the fluid wave, where you go really slow, you find a little spot and then you slowly creep it up. And then lastly, I like to combine bending the knees and swinging the legs side to side like windshield wipers. And that's usually the cross friction that I'll do. Let's take about another 45 seconds or so here and roll. Now, with regards again to the shoulders, kind of revisiting that, when it comes to the rolling pattern, a lot of people do have discomfort when they're just trying to hold their body weight up, whether they're on their side, they're on their back, and there's really no way to do it on the ground without doing that, unless you're using a very small ball like a lacrosse ball, and you're just on the ground and you're just moving your leg on the ball but there's generally going to be a little more support. But for the hamstrings, sometimes you can just lay down completely and lift your body weight up. And you can do this side to side. That's helpful. And for the calves, you can do the same thing. You can just lift your body weight up and go side to side or roll it in and out. And you can always do one at a time as well. So those are a couple of modifications that I think may be helpful. And then we'll just finish up with our quads. So we're going up and down the front of the legs. If you're still in the same spot, make sure you move over to a different area of the quads. If I've got patellofemoral pain or knee pain that I deal with a lot, sometimes I will definitely just, like I'll move the roller to the side and I'm just gonna focus on one leg, that same leg that has the issue, and I'm gonna take my time and go real slow, up and down, searching through the tissue, finding little spots that are tender, pause, bending the knee, lengthening the tissue under it as I roll. Good. All right, so we should be finishing up with the front of the leg. And when you're ready, just go ahead and come off. Take a moment. You just did your own full flush for your lower body. So that was basically all of your hips, front of the leg. There's one last spot that I wanted to show you, and that's the inner thigh area. And then that basically is the whole lower body. So the inner thigh area, what you can do is you turn the roller the same direction as your body. So it's not horizontal, it's vertical. You're going to take your leg out to the side. I call this the Captain Morgan position, where your leg comes out to the side. But you want to bring your leg out to the side, and then you want to turn your hips towards the ground. With your hips facing towards the ground, now you're rolling in and out for the inner thigh towards the knee and towards the groin. But don't roll the groin, don't roll the knee. Usually there's like one or two spots that are kind of tender, and I'll pause and I'll just straighten and bend the knee. Or I'll pause and lift my heel a few times. And then I'll flush it out. I do typically, after I do like a pin and stretch or a cross friction in one area, I'll typically do like a little flush pattern after, where I roll the roller back and forth a few times before I move on. Let's go ahead now and switch. So when you switch, just lift up your body, roll the roller underneath you to the other side, bring the leg out to the side like that figure 4 shape, turn your hips. It's important, turn your hips towards the ground. If you don't turn your hips towards the ground, you're not going to feel it. And then you roll. Again, just finding any spot that feels tender. You can bend and straighten the knee. Or you can lift the heel up and down. Good. So as we finish up there, that does conclude the lower body. Hopefully you all are already feeling some of the benefits of that. You may feel that sense of increased blood flow now going through your legs, a little bit more ease of your joint structure to move around. I find that just that alone, I don't have time to do anything else, just that alone makes my entire body feel better, because this is our locomotion system. The way we stand, walk, carry ourselves, and do everything comes from the lower body, and that's a great way to create some balance in the lower body. Now, your upper body, we won't actually do like our arms today. That's not part of my typical full body flush. I could talk about that, but that would be a whole long discussion. Just take for granted to say that when you're working with the shoulders and trying to improve your neck and shoulders, your thoracic spine is number 1, and then working on some areas that are around the shoulders would be number 2, and then the neck. And so that's what we're going to do next. I'm going to turn sideways so you can see me, but you're going to position the roller just behind you. We're going to roll in the spine. Now, this is kind of important. I don't know what kind of foam roller you guys are using. If you got a really hard one, it's not going to be as comfortable in your spine. It usually works better to use a softer one. A medium firmness like what I've got works great. I've yet to really encounter anybody that has a huge issue with this. If you do have osteoporosis, severe osteoporosis, then you don't want to use much pressure, if any at all, in your spine. And you might want to wait this part out. If you've got like surgical implants, say maybe you've had scoliosis and you have rods in your back, then you might want to wait this one out. I have other options for them, and usually that stuff is done on the wall. But if you've got that type of thing going on, those are kind of contraindicated. So, you know, you put too much pressure on a rib or something like that. If you have severe osteoporosis, excuse me, it's not a great idea. So, but for everyone else, this is totally safe. There's usually no problem at all. And what you do is we're going to be rolling the thoracic spine primarily. And the thoracic spine is where your ribs are. So what you're going to do is position the roller behind you. and you're going to lean back on it. I call this the women, it's your bra line, and men, it's your bro line. So we're just going to find that spot right below the shoulder blades on either side. You give yourself a hug, a nice big hug across. Tuck your chin, look towards your knees, keep your chin slightly tucked, lift your hips up, and roll towards the shoulders and then back to the starting spot. Towards the shoulders and back to the starting spot. I do this about 8 to 10 times, up and down. By hugging yourself, you're going to be able to open up the ribs and expose some of the paraspinal muscles a little bit better, the deeper level. After you've done a few of these, you're going to take a quick little break. You can reposition the roller if it got away from you at all. The next one we're going to do is with our arms in a little bit different position. Same starting place. Hands come up behind the head with the elbows out to the side. And now we're going to do the same roll. But what this does is it's a little more superficial. You'll probably feel your shoulder blades are a little more involved. This is going to hit a little more in the middle trapezius, lower trapezius. And I want you to do another 8 to 10 rolls like this. And now what we're going to do is as you finish up, you're going to park your rear end down, keeping your elbows out to the side. You're just going to roll over towards one shoulder. When you get to that, what you want to do is you want to have the roller itself positioned on the back of your armpit. I'm going to kind of stand up here so you can see, but if I were to just put the roller here and let my arm hang over the top of the roller, right there where my thoracic cage, rib cage meets my shoulder, that's your lat tissue, the back of your armpit. That's where we're at. And as you lay there, you probably notice this is like the IT band of your shoulders right here. Like this thing can be kind of tender. So I call this my best George Costanza pose. I'm just hanging out on my side like that. My hand is supporting my head, and I'm going to roll side to side across that part. This is really all it takes. Most of you are already like, holy moly, especially if you have shoulder and neck pain. This is a huge, huge area of chi stagnation. I find all kinds of issues come from just treating this one area. Very simple, very, very simple. And you can also pause if you want. You can move your arm a little bit up and down or bringing it across and in and out like a windshield wiper. But honestly, most people just hang here and side to side's all you really need. Good. And then after that one, again, the benefit of having a long roller is I can just roll right over, but if you need to reposition your smaller way, we're going to go roll over to the other side. Same exact move. We're just going to go side to side. Kind of get a sense of where your shoulders are today. This is really, really nice. You should be able to lift your arms overhead much easier after we're done. Feel free to pause over any tender spot. Add a little bit of arm movement. Again, you can go in and out or up and down through flexion and abduction. Good. And then what you're going to do is you're going to roll back to the center and let that roller come up to right behind the head and neck. This is the icing on the cake right here. What you do is just find a spot on the back of the neck and head that feels like it's comfortable to you to hang out. Put your head right on top. And all I want you to do is I want you to roll your head side to side, giving yourself a little massage across the back of your neck. This should feel pretty awesome for most of you. And then what you're going to do is you might notice like when you go to one side or the other that it's a little more tender on one side or the other, a little more lumpy on one side or the other. So what you do is you go towards that side, hang out there and put one hand and then the other hand on top of your head, and just the weight of your hands alone is enough. You don't need any more, just that little bit of compression. Do about 3 or 4 nice deep breaths. And then go ahead and come off. Now, wherever you had the roller, most of you position it either high or low. So if it was up behind your head, you're going to move it down. And if it was right under the base of the neck, you're going to move it up. So just put it in whatever position you didn't have it in. And we're just gonna do the same thing one more time. So I had mine a little lower down. Now I'm just gonna move it a little higher up. So it's right behind my head. And I'm gonna do the same thing, rolling side to side. And I don't have an imbalance on either side, so I'm just gonna kind of hang out in the middle for a moment and take a nice deep breath in and out. There are some major acupressure points here, gallbladder 20 being one of them. This spot is like the headache spot, right? If I have headaches, migraines, neck tension, cervicogenic tension, I've been staring at a computer screen all day long for too long, this is a really great spot. They make this thing called a still point inducer where you can just lay on it and do the same thing. This is just wonderful. And then when I get done, I take that out. I'm gonna lay on the mat. I'm just gonna close my eyes, and I usually do a nice 30 seconds to 2 minutes, maybe longer, as long as there's no kids that are gonna, come in and jump on me. And I get a little bit of breathing. And then when I'm done, that's my full body flush. Hopefully you guys got a good benefit from that, and you might be able to get a sense right now of what it feels like to already have better blood flow, better circulation, the chi energy flowing through your body easier. I find that after a full body flush, I like to do a nice, gentle stretch for most of the areas of the body. I'll do all kinds of stuff. I teach yoga and a bunch of other things, but if you have your own stretch routine that you like to do, then go ahead and do that. Just stretch the major areas of the body, the calves, the knee area, the quads, the glutes. You can usually do some nice spinal flexion and extension, do some shoulder stretching. There's a lot of different exercises and stretches that you can do. But in a classroom environment, when I'm teaching at a yoga studio, we typically will do a flush pattern where we'll go through the body and then some stretching stuff that goes with it. If I'm doing more like invigorating work before I'm starting a workout, then I typically don't do a full body flush. I may flush my entire lower body if I'm doing squats or I'm doing lunges or I'm practicing Mabu or horse stance. I may go ahead and do my full body and just flush out the lower half, and then I'll work on some just very gentle warm-up exercises and stretches that really help a lot. But that full body flush pattern is what I'll use several times a week. So other than that, I'm gonna let you guys ask some questions away now. Hopefully you guys are all sitting there like blissed out, feeling good. But if anybody has questions or anything else they wanna go over, let me know. I am gonna share some information on the screen again in a minute, but right now is a great time if anybody has questions.
One was, can you just review again how much time should be spent on each area?
Yeah, hold on, let me fix my microphone, it fell in my shirt. So the amount of time depends on your intention. Remember, everything requires intention. If you're doing it mindlessly, it's not gonna work. Your intention reflects whether or not you're gonna invigorate or tonify or sedate, or if you're just looking to disperse. Usually, when you're sedating and bringing things down, you're gonna spend a longer amount of time, being about 30 to 40 seconds. And on the other end of the spectrum, if you're tonifying and invigorating, it's about 10 to 15 seconds. And dispersion can be somewhere in between. It just kind of depends. Dispersion is just using a technique to help that area feel less tight, less discomfort, so that you can typically move. I find dispersion is the one I use most often, and then I'm intuitive as I'm rolling. If it's a full body flush and it's the middle of the day and I still got to go to work and do a bunch of stuff, I'm not probably going to go deep in a lot of those areas. But if it's at the end of the day and I'm feeling pretty wrecked, I'm like, yeah, I'm probably going to spend a little more time. Hopefully that helps. Any other questions?
Can you discuss maybe some recommendations or some differences in rolling for injuries versus flexibility?
Yeah, I mean, the main thing there is sedation and tonification. So typically, if I am rolling for an injury, there's something that hurts. So let's say it's my back. I've hurt my back, I bent over, and now I've locked up my back and I can barely move. I'm usually going to use a pattern that helps with that. Now I have videos and stuff like that for every single joint in the body, low back, neck, hips, shoulders. It's very specific, and what we do is we do a very specific pattern of foam rolling and recovery for that area. For the low back, for instance, I might actually take a 5-inch ball, and I might use that and lay down on the ground and try and release my own psoas hip flexor area. Whoops, hold on, I lost my microphone. I might try and release my own psoas hip flexor in a face down position. That's a whole nother class. And then I'll flip over, I'll release the glutes, and I'll do it all lying. And I'll use something like a 5-inch ball because I really like the way that that works with penetrating the tissue and being able to create the type of sedation or inhibition I need for that pain syndrome. If I'm treating pain or an injury, I always couple it, well, triple it, I guess. There's 3 things I always do. I always do a reset, a restore, and a reload. And this is what I teach in my workshops and my certification program. The reset is what we just did. Anytime you're using a mobility tool to improve the mobility or the motor control, meaning the joint moves better or works a little bit better when you're done, that's called a reset. It's just like hitting the power button on your Nintendo or something. You've reset the way the area is operating. So again, in my low back, my reset would be release the hip flexors, release the glutes, work on the paraspinals, and sometimes the hamstrings. I do the reset first. That's using the mobility tools. After the reset, we want to restore. What we're trying to restore is an optimal range of motion in whatever that area is. So in my low back, I'm trying to restore normal patterns in the hip of flexion, extension, abduction, internal rotation, external rotation, adduction. And in the spine, I'm trying to restore flexion, extension, and rotation. Once I've restored the range of motion, and usually I restore it with basic like yoga-based exercises and postures or stretches. Sometimes it's dynamic, sometimes it's static, depending on the area of the body. Then I go into reload. The reload is you want to reload that area of the body in a way that's going to make it activate, turn on, and be supportive, especially in your back, because your low back is supposed to be a stable area of the body. If all I do is go in there and beat up the tissue and make everything all weak and loose, and I stretch it, and that's all I do, then my low back's going to be prone to more instability, probably going to get re-injured. I may not do all that in one session. Depends on how much pain I'm in. Depends on where I'm at in the injury. If it's a chronic injury that's been there for 3 months or more, then I might go ahead and do all 3 of those. If it's more acute, then I'm not going to for sure. All right, that was very complex, and hopefully that answered your question. Any others?
Yeah, we have a few more. I guess for just a quick question for you. We are at the time right now, but I don't know if you want to say anything, like any final words first, so people can take off.
Yeah, what I'll do is I'll just switch my screen over to the information screen that I was going to share real quick, and then I can finish up with whatever questions you guys had. So the last part I was just going to share was, wait, is that on here? It should be on here. So this is all in the PDF that I sent you guys that basically walks you through exactly what we just did. And then, you know, like, if you want to go further with understanding your own body, it helps to actually have somebody do an analysis of your posture and movement, which can be done pretty easily by somebody like me who knows that stuff. You can do it online by submitting videos and doing telemedicine stuff. And that is something that I do. So if it's something that interests you and you want to learn more about that, you can easily visit me online at drlancerobbins.com. I have a little button at the top that says book an appointment. And you can, when you click on that, you can scroll down, you'll see telemedicine services, and you'll see these things on here: the functional movement screen, the selective functional movement assessment, which is for pain. The FMS is for function. Let's say you're not really in pain, but you want to move better. And then we can do posture analysis work too. And then there is that coupon code that's available. Barking Rabbit will give you 15% off. But that's it. If there's any other questions, or if people got a jet, go right ahead. And then that's it.
Okay, so I guess we'll go back to the questions then.
Sure.
So another one was, is there anything particular to do with the tarsal bones on the ankles that might be jammed?
Yeah, yeah, absolutely. Tarsal bones in the ankle that might be jammed. Well, you can do your own basic mobility work with that. I like to use the lacrosse ball first. So I'll usually go pretty deep with the lacrosse ball around the foot and the ankle on the bottom because there's 4 layers of tissue with it. I'll usually go ahead and do some deeper work in the calf and the peroneals and the, so you got the back of the leg. I've got some tape on here because I stepped off a curb wrong yesterday, but you know, along the back of the leg here, the inside and the outside, I'll usually go, because if your bones are locked up, you want to inhibit and relax the area. And then you've got a couple of choices, but I use banded distraction or voodoo flossing. Voodoo flossing is, if you want to Google voodoo flossing, you can find millions and millions of videos on it. But you basically take a band, like it looks like a big bicycle tire that's been cut in half, which I think that's what the first one really was. And you wrap it around the whole joint structure, which all the wrapping creates compression, which creates joint distraction. So the joint will usually distract. And then you can move the soft tissue on top, or you can move the bones underneath. It's pretty cool, actually. And so that's one. And then I'll use banded distraction. So sometimes I'll take a really strong monster band style band, the kind that you'd use for assisting yourself for pull-ups. I'll wrap it around something, and then I'll put it around the middle of the tarsal bones, back my body weight up, hold on to my toes, and allow the band to gap that tarsal or a subtalar joint, if that's the joint I'm going for. The subtalar joint is probably the only one that you're really going to be able to do well with. The cuboid joint is way harder to do. I've yet to have a just fantastic cuboid self-adjustment that happens. And then also, if you're doing like the mid-tarsal bones, you can grab and you can do like your own simple mobility for the mid-tarsal, the cuneiforms, and all of those. Those are really simple. All right, any others?
Yes. Should you avoid vigorous exercises after doing a full body flush?
No, not. You could go right in. In fact, that's one thing I'll do is if I really want to have a nice, great practice, I may start with a full body flush and focus more on dispersion and not sedating my body. So I'm not really going to spend a lengthy amount of time in any one area. I get done, I do some nice, gentle, full body stretching, maybe a little yoga pattern flow, or I even use the barking rabbit warm up. It's a great little warm up. And then I'll go into some sort of exercise program right after. Any others?
Yeah, we have one more, unless more come in. Let's see. Do you roll your lower back?
Yes, so there is some very specific ways to do the lumbar spine. I didn't get a chance to go over those today. It's the lumbar spine doesn't have the same support system as the pelvis and the ribs above and below. It's going to have, you know, it's just joints that are stacked on top of each other. And so for people, I don't find it's as beneficial to use a giant foam roller in that area and then try and fulcrum the body over it and roll up and down. It really depends on you. If you're the kind of person who has pretty stout low back muscles, then it's no problem. But if you're like me, I'm pretty small and petite, then it doesn't do as well. I like to lay on the ground and use like a lacrosse ball. I'll position it on one side of the spine. This is part of my low back routine. So it's just to the side of the spine on the quadratus lumborum muscle, the QL. And then I'll put my body weight there and pull my knee into my chest and use that type of method. If I'm doing flushing for the low back, honestly, I like the water-based Qigong where you bend forward, come up and tap the kidney area with your hands. I think that works really, really well. And then for the low back, I believe you need to, if you really need to work on it, you've got to get to your psoas hip flexors in some capacity. So I'll usually do the face down on a 5-inch ball and try and get to that area as well. And was there any of the others that came in?
Nope, that's all we have for questions. And
all right.
We let everybody everybody's able to unmute themselves now. So if you guys would like to thank Dr. Lance with your own voice, then you can do it.
Thank you guys. It's been an honor.
Thanks, it was great.
Thank you so much.
Thank you very much.
Thank you very much.
That was great. Thank you.
Thank you.
Thank you.
You're welcome. You're welcome. I hope you guys have a great rest of your Sunday, and I look forward to seeing you all again someday.
Yeah.
Sure.
Take
All
care.
right.
Yes, thank you.
Have a great day.
Guys.
Bye-bye.
And thanks to Michelle and John for putting this on. That was great.
Oh, yes, definitely.
Yes.
Sure.
Thank you.
Michelle and John.